Your doctor sees high LDL cholesterol and instantly thinks statins. And while you take a statin, yes, your LDL cholesterol may drop, but remember the prescription has to be refilled. So 6 months becomes 2 years, and before you know it, it's a decade. And has anybody ever asked the question that you should have thought of first? Why did your liver make more LDL cholesterol? Because here's the thing, guys, your liver doesn't just raise cholesterol randomly. Hi, I'm Dr. Aaron Ernst, board-certified functional medicine practitioner and chiropractor with 22 years of practice with patient care. In this video, I'm going to show you exactly what's driving your LDL up and what the statin is costing you in the long term and what actually brings your cholesterol down for real. Okay, so look, here's the thing. Your liver isn't actually responding to cholesterol. Cholesterol isn't just a risk marker. Your body uses cholesterol to build cell membranes, produce hormones, and your liver raises the output when the vessel walls of your arteries are inflamed and they need to be patched. Here's the thing. LDL cholesterol goes up because there is an active repair process. And this repair process is something that's going on inside the vessel walls because they're under stress. They're either inflamed or they're being damaged. So to blame cholesterol for that damage is like saying the firefighters who are coming to put out the fire were the reason the fire was there in the first place. That myth, the cholesterol conundrum, has been out for a long time. And your body isn't producing cholesterol randomly. You know what it's doing? It's responding to a signal from the vessel walls in your heart and in your body. When you block the production of cholesterol with a statin, yes, the number can go down. But what does that do to the damage of the vessels in the first place? Your liver keeps trying to respond because there's stress, so the LDL cholesterol goes back up. And then you have to take a drug to lower it down, and then it goes up, and it has to come back down with drugs, and the drug hasn't ever touched the reason for the increase in the first place. That's why so many patients on statins still have cardiovascular events. Did you know that 75% of people actively having a heart attack have normal cholesterol levels? Their LDL numbers are being controlled, but the vessel walls are still inflamed, and that's why they still have heart disease. And nobody figured out the original source. So here, I want to teach you something. What a statin blocks along with cholesterol is an enzyme called HMG-CoA reductase. Whew, that's a tough one, right? Your body uses this enzyme, though, to make cholesterol and to make CoQ10. And CoQ10 is a compound that's found inside the mitochondria that drives energy production. ATP is energy. Your heart is a muscle and it has an extremely high demand for this energy and it needs ATP. So look, your heart cells, need a steady supply of CoQ10 in order to keep producing the energy that they need. So let's do the math. You take a statin, it blocks HMG-CoA and CoQ10 production drops. So your heart, which is a skeletal muscle, needs the CoQ10 in the first place. So that's why so many people are fatigued and have muscle pain when they start taking their statins. And if you listen to the side effects, it even says like you could have severe muscle pain. A lot of people taking statins also say that their energy drops because look, the cholesterol number itself, when it goes down, your heart uses cholesterol. Did you know that? Your brain uses cholesterol. Every cell in your body has to have cholesterol. So the effects that come from blocking the same enzyme, this HMG-CoA reductase, yes, it lowers cholesterol, but it also sucks the CoQ10 out of your body. So your liver recognizes this, and what happens? It increases the output of LDL cholesterol. So the vessel walls of your body, they're inflamed. And what happens is LDL production starts to go down because you're taking a statin and you can't clean the vessel walls. So the enzyme is trying to do its job, but it's being blocked by the medication. So CoQ10 production ramps up. Cholesterol production ramps up. And your numbers start to get worse and your doctor says, you need more statins. So look, before we get to the test that I'm going to talk about today and how to fix your cholesterol, every single week I put out videos that I put onto this stream to ask the hard questions and give you the answers that most people and most panels and most doctors miss. Okay? If this topic matters to you, you're going to really like what we're going to talk about today. So make sure you hit subscribe, activate the bell. The bell is the most important part. That bell tells you when we're live. Okay, look, we're live every Tuesday at 9:30 a.m. Eastern for Q&A with Dr. Aaron Ernst. We're also here every Saturday at 3 p.m. for the Ask Dr. Ernst show. We have all kinds of fun content and interviews and everything. Guys, it's all free. Okay? So what nobody looks for in a standard cholesterol test is what actually you need to look at. Yes, you can look at LDL, and you can look at HDL, and you can look at triglycerides. And yes, when your LDL is above the threshold, your doctor's going to prescribe a statin because they are just an if-then kind of clinic. If the numbers are high, then prescribe a drug. And they're probably going to wait 90 days, and then they're going to test it again, and then they're going to say you need to take more. And you guys know this trap we all get stuck into. What no one is asking, though, is what's causing the inflammation to your vessel walls. Remember, the endothelial lining, the inner lining of your arteries, is where the actual problem is taking place. So there's 3 things that show up consistently along with elevated cholesterols that you should actually look at. The most common thing that I find in people with high cholesterol is increased gut permeability, or what's known as increased intestinal permeability, or what's also known as leaky gut. Okay, when your gut lining breaks down, little tiny bacterial fragments enter your bloodstream and they trigger an inflammatory response. If you're a nerd like me, look up LPS, leak, and heart disease. LPS, lipopolysaccharide, leak, and cardiovascular disease. Okay, the cholesterol that you see on your panels is from your liver, and it's trying to repair the damage in the intestines. There's little tiny holes leaking. Cholesterol is sticky, so it goes into your gut and it says, let me plug that hole. Okay, insulin also has an issue here because people with insulin resistance almost always are connected to the same issue. Insulin raises cholesterol. Insulin causes high blood pressure. And remember, blood sugar is also damaging to the vessel walls because sugar acts like glass. Okay, so high blood glucose damages the vessel walls years before you will see diabetes as a diagnosis. Okay, so by the time sugar is high, the problem's already been there for years, building up as chronic inflammatory load. Then you have the toxin exposure of the lipopolysaccharides, or the bacteria pieces in your blood, and this steady burden hits your liver, and the vessels inside your liver get inflamed, and the response? Elevated cholesterol. Okay, so each of these are fixable. Another thing you should look at is high sensitivity CRP, also known as HSCRP. It's an actual blood test that measures inflammation in your heart. Okay, a fasting insulin test is very good because it will find insulin resistance long before diagnosis of diabetes. The HSCRP finds the inflammation in your heart long before a cardiovascular diagnosis, and an intestinal permeability panel will show if your gut is leaking, letting bacteria fragments in your bloodstream long before the diagnosis of heart disease. So together, these 3 give you a massive picture of what's going on as to why your cholesterol is high. Okay, now let's talk about this. What actually brings LDL down? Okay, number 1, well, you have to repair the gut permeability. You have to stop the bacterial fragments, those lipopolysaccharides, from getting into your bloodstream. Inflammation in your vessel walls can come down, and your liver will stop increasing the output of cholesterol because the signal for the repair has been fixed. And watch this, if you address insulin resistance, you can slow down the glucose damage to the vessel walls. And if your total inflammatory load drops, guess what? Your liver shifts back into normal cholesterol production. So in this case, LDL goes down, not because of taking a drug, but because the damage was repaired in the first place. Now watch this. You're no longer needing a statin, so your HMG-CoA reductase works. And now you produce CoQ10. And now the vessels and mitochondria inside of your heart, they say we can make energy. And then guess what? Your inflammatory markers continue to go down. And here's the best part. The vessels that are lining your arteries of your heart can now repair themselves because the damage and the inflammation is gone. So you don't need the LDL anymore, so it starts to pull itself down. Now remember, most of you have probably had a cholesterol panel done, so I want you to pull your most recent test. If there's no HSCRP on there, nobody's looked for the inflammation in your vessels, and that's an issue. Look to see if you've ever had a leaky gut permeability test, and check to see if your last blood work didn't just have glucose and A1C, but also says insulin, okay? Fasting insulin is very important. These tests can help you differentiate between what a standard panel looks at, your cardiovascular panels from your cardiologist, and what an actual heart panel does. Okay, so now, 2 questions you need to ask your doctor on your next visit. Well, ask them for an HSCRP and a fasting insulin. Okay, that's where the picture begins. High LDL is a measurement of what your liver is doing. Okay, the diagnosis often happens because there's stress in the vessels and your liver's responding the way that it was designed to. So if you find out the entire picture, rather than just looking at your total cholesterol numbers, then we're not just going to go off statins. We're going to deal with the original issue. You won't have the fatigue and the muscle aches and the chronic tiredness from those statin drugs. Instead, we're going to fix the actual cause. So the mechanism is the issue. When you take a statin, you deplete the enzymes that make CoQ10. CoQ10 is needed for heart production and for repair of the vessels. So see why it's a trap. That's why you constantly have to stay on the subscription of your prescription. Okay? Look, I want you to do something. Check out the video that you probably see on your screen somewhere around here. It's called Chronic Fatigue is Not an Energy Problem. It's going to help to answer why you're so tired all the time. And in fact, it's going to give you the next thing you need to do in order to become your own cardiologist. Thanks for tuning in. And remember, every Tuesday, 9:30 a.m. Eastern, and every Saturday at 3 p.m. is the Ask Dr. Ernst Show. Be blessed, guys.